Thank you for tuning in to Macroview Television and welcome to a brand new edition of Taiwan Outlook, the program that presents the different faces and lets you hear the different voices on Taiwan. I'm your host, Ray Guo. International humanitarian assistance has been very important to many people and families in the less developed regions and countries around the world. On today's program, we're delighted to have Ms. Liao Min-Lun, who's currently an international humanitarian aid worker, to share with us her experiences in helping less fortunate people around the world. Welcome to our program, Min-Lun.
Hi, it's my pleasure to be here.
Well, it's a pleasure to have you on the program, Min-Lun. And first of all, let me ask you, can you tell us a little bit about yourself, including your education background and also your experiences in the last few years?
I got my master's degree from Taiwan Medical University and focus on public health, especially in epidemiology.
Oh, okay.
So that's why my work always focuses on health issues.
Okay.
And then my experiences in the past few years, actually, my first time to join the field is my undergraduate school.
Really?
Yeah.
You also went to Taipei Medical University for undergraduate, right?
Yes,
You're studying public health.
Yes, also.
Okay, and were you always interested in being an international volunteer?
Actually, at the moment, at the time that I'm innocent I didn't know everything at the time.
Okay. You just felt it was something interesting, attractive to you?
And actually, it's kind of the opportunity because I joined the social and medical service first group in the school.
Okay.
It's one of the club in school.
Okay.
So it's our first time to go do some service out of Taiwan in Thailand.
Okay.
Yeah, so this is my first time. At that time, I didn't know everything about that one, or what's the global health, what's the humanitarian aid work.
Okay.
I don't know everything, but when I come back, I just felt that I'm fulfilled.
All right.
When I come back, and later on, actually, I got the opportunity to join the medical mission with Dan Church.
Okay.
Actually, it's kind of Christian mission to Malawi at that time.
All right.
And my work there is the same as what we did in Thailand, just to provide some medical service there.
Okay.
But when I come back, I just thought I'm so confused what's going on in the world because it's quite incredible and it's totally different from
Taiwan.
Yes, right.
Right.
And actually at that time I didn't decide what I want to do in the future or what's my career plan.
All right.
But I didn't have any hesitation to do this work. I just, if I got the opportunity, then I would go there.
All right.
And then later on, when I finished my master oral presentation, and then the next day I just fly to Malawi again to stay there longer for 3 months at the island.
All right.
Yeah.
But let me ask you, Min-Lun, I mean, while you were an undergraduate student at Taipei Medical University, there are many different student clubs or organizations that you could have joined. Why did you decide to join the Medical and Social Services Club? Is that because it was related to public health? Was that the reason?
Not really, actually.
Not really. And did you have some friends that they were involved in medical and social services?
Yes, I have.
Okay.
But I don't. At the time when my friend told me, "Hey, probably you can join us to do something." Mostly, we spend much time in Taiwan in rural area like Hualien or
Taitung
or Lanyu. Yes, like this area.
I mean, we all at one time 20-year-old, so we didn't know exactly what we wanted to do. But but later on, after graduation, after you finish your master's, I mean, why did you decide to motivate yourself further to move from being an international volunteer to become a full-fledged international humanitarian aid worker? What was the motivation?
The first time to go to Africa, it's quite, for me, it's
yeah, it was an eye-opening experience,
yes.
I would imagine.
Yeah,
Yes.
and then actually I didn't know everything at that time, but I have so many questions of my life and in the world. What's it look like, the world?
Okay.
Just why so many people living in this condition? And I got some lessons, but at the moment I didn't know.
No.
Yeah, when I look back 10 years ago, then I just thought, oh, I got it.
Okay.
So what's going on at that moment? What I decided to do this kind of work.
Okay. So in your exploration, so to speak, where are the places that you have been to? Since graduating from, college and also graduate school,
Right.
where are the places that you have been to as an international humanitarian aid worker?
My first experience is in Thailand, right, in
Thailand,
undergraduate
yes.
school. But I went to Malawi.
Malawi.
Yeah,
Yes.
and actually I went there in 2005 and 2006, but in
Okay.
the same country, but it's different. But I stay in different places.
Okay.
And then I just told my mom that it's possible to give me half year to spend. I would like to travel around the world and to find what I want to do, because I didn't I work to be a summer intern in the lab, but I didn't really like all step in the laboratory actually.
All right.
But I'm not sure what can I do, but I don't want to work in the government because it's just normal work. I'm curious about what's the word.
Yeah,
so,
what's available out there.
Right.
Yes.
So that's I just told my mom it's possible to just give me half year and to travel around there. So I take the chance to go to Malawi again to stay on the island.
For 6 months? Did you
For
say?
3 months.
Oh, 3 months, okay.
Yeah, and I just take a break when I go back, and then I just went to India, South India.
South India.
But it's an Tibetan in exile community and in the settlement. And so during that period that I got shocked, then
about the conditions that people live under.
Yeah, and it's extreme words like Africa and India. After so many people were afraid when they heard of India. But I just forced me that I can't do any work before my leaving there.
All right.
I just want to see and to learn and to hear by myself what they are doing and what's the.
That's very good, Min-Lun, because that leads to my next question. For all these, very, extremely harsh places, or the conditions are very poor, how did you make the adjustments for yourself? I mean, it was obviously very different from the comfort and the, convenience that, Taiwan, the place that you grew up, offered you. All right, but when you travel to South India, to Africa, parts of Africa, those places are very different from Taiwan. How did you make the adjustment yourself?
I think I'm really lucky and I'm blessed because I really didn't feel any different.
Really, but
I can go to Africa now, or it's for me, it's fine.
Okay, but weren't you concerned about, for example, the food?
No, not really.
The health, threats, some of the, communicable diseases. Were you concerned about any of those things?
At that time, my parents or my family concerned this most, but I just think that because I do some desk research already, and to get some vaccination, and to prepare some medicine in case I need, and I think that I prepare it very well, so I can go there.
Okay.
So I didn't.
You didn't think it was going to be
it's a problem or obstacle for me to to stop me
to not
there.
go. Okay.
Yeah, right.
But what was the reaction from your family and friends when you told them, hey, Mom and Dad, I'm going to South India next month? What was their reaction?
Actually, my parents really support me to do this kind of work. Yes.
Good for you.
Yeah,
yes.
so that's what I'm saying.
How about your friends? They say that, oh, Min-Lun, we're not going to see you for 3 months. We'll be going to karaoke and singing. We'll miss you and things. Did you ever think that, hey, maybe, I want to stay behind in Taiwan and then, continue to enjoy your friends and family?
They know that I want to do what I want to do.
Okay.
So it's better to let me free.
Okay.
And if they need me or sometimes, then they know that I will show off.
Okay. All right. So it was something that your family and your friends, they all supported. And and there was very little adjustments that you had to make. But of all these places that you traveled to, what was one area or a particular story that struck you the most? That gave you a very strong impression about the poor conditions that many people still live under in the world today.
Yes. I need to mention about my life in Malawi. On Lake Island. Malawi Lake is one of the islands, the biggest island. And I stayed there. I spent, I think, more than 2 months in the healthcare center and to work with them. Okay. Because at that time I just have some small project that's just like have some survey. So I just stay with them to work with them. And because it's the island, right? So mainland, there's only one ferry once per week.
Once a week?
Yes.
Okay.
So if I miss the boat, the ferry, then I need to wait for 1 week more. Okay. So actually, it happened that I missed the ferry at that time. So, but it's the harbor in Malawi that it's quite complicated and it's unsafe for me to stay there alone. Of course. Right. So at the time that the leader of the Dan church that asked me to go with them to Taiwan medical mission to stay there for 1 week. Okay. So later on they sent me go to take the ferry again. And what I'm impressed that because once per week, right? If it's broken, then there's no one can reach on the island. No. So there's no resources, and I can. There was
no food.
No food. Well, because at first I didn't know what's going on. I just know, hey, what's the supply? Yes. Ferry this week.
Back?
They didn't come back. What's going on?
Yes.
Yeah, because I need to buy some eggs or scone in the small grocery in the corner. When I went to the hospital and to ask them what's going on, I can't buy anything probably 2 or 3 days later. And they told me that, the ferry is broken. Then I just say, what? So?
Yes.
So?
That's terrible news.
Yes, right. And how to, and when will you be fixed? And then they say, didn't know. And I just asked, it happened before? I said, yes. And how long? They said, probably 2 months or 1 month. Ooh, probably more than 3 months, and then I can go. I can't go back on time at that time. And later on, probably 1 or 2 weeks, I finished our food. And because every day I just stay near the lake, and I need to walk to the hospital for 15 minutes. And I will pass by the markets, the local markets. And when I go back, and then I would buy something on the way back. So I just see that, the food is less and less day by day. Of course. And then I just say, what can I do? Because at that time I just actually I got the rice from Taiwan, not medical, the agriculture mission from them, and also I just bring some resources for living. And when I see that, it's almost finished, what can I do? But I have no idea. And then, but I'm worried that how about the local people? And I found one thing that they don't worry about it because they can go fishing in the lake, but I can't.
No.
Yeah. So at that time I realized, oh, I have money, but I can buy anything, and there's nothing I can buy.
Okay.
So it's quite incredible thing.
Yeah, it was a lot of pressure on you. Did you have any friends on the island at the time?
No,
Do you know
there are
anybody?
only 4 foreigners.
Okay.
And the couple is working in the church, so the church will provide them some food.
Okay.
And the other one is he is from British and the United Kingdoms.
Okay.
And then I forgot what's going on. Maybe at the time he is not on the island. So I'm the rest of the other one.
Okay.
So, but I don't know how can I do, and also because I can buy the prepaid cell phone card.
Okay. Yeah.
So
you call your parents?
I can't.
You can't.
I can't.
All right.
I couldn't at the time
You couldn't reach anybody.
Yes. So, but probably I don't know what's going on because my parents cannot reach me at the time. So they call the MOFA, Minister of Foreign Affairs, and what's going on. And then because there's one ambassador, the representative will contact me regularly.
Okay.
They would like to know whether I'm still alive or not. Senior schoolmates.
Okay.
She's working in Taiwan Medical Mission. And then she used over the director, I forgot, they call the emergency call to the healthcare center because they know that I work there. Okay. So they got
in touch with you.
Yeah.
All right.
At that time. So,
all right.
So they know it or what's going on because the ferry is broken at the time. And finally the director of the healthcare center invited me to have dinner. To have meals at home.
Okay.
And also the director of Taiwan Medical Mission, then he came here. I think he would like to know whether I'm okay or not. So
exactly.
Yeah, so he came here for work.
All right.
Yeah.
But that experience, of course, would have been very difficult for anybody. And did you ever have second thoughts to say that hey, Min-Lun, maybe I should not stay in these places anymore. But ended up, you went to South India. And you mentioned earlier that you were in the Tibetan refugee settlement. And tell us a little bit about that experience.
And because I finished my trip to Africa, and then I just take a break in Taiwan, and then later on I was selected to do a volunteer to conduct the small survey, especially for the elder hypertension. They would like to know identify some risk factors of hypertension in the settlement. Okay. So that's why I went there for 1 month, I remember. But
all right.
So it is my first time to go to India. Yeah. And then also I went there alone because I thought that probably everyone is the same, just like they went there everywhere by themselves. So I just take it for
So you
granted.
did the same thing.
Yeah. Yes. I just it's okay. They just told me my mentor just told me, when you went out the airport, you just turn left and you could see the prepaid taxi office. Then you just buy to book the taxi to go to Shangri-La Hotel. It's just like a guest house. And I just stay in room 301 like this. And then I just go there in the morning, 2 o'clock, I remember. Was there
any story that you can share with us? Tell us a little bit about the conditions in South India.
Actually, I got sick for 1 week at a time.
Really? Sick over what? I mean,
for high fever and diarrhea. And just like, it's quite terrible at the time.
All right.
But actually, the people there is quite friendly and they are quite kind to me.
All right. But, I mean, we also understand that you were, a volunteer, when you were in college. And you, of course, you mentioned that you went to places within Taiwan, Hualien, Taitung, and Nantou and places. And did you think that experience as a volunteer really helped you prepare yourself for the subsequent international humanitarian, aid that you, delivered? Did that experience really help the subsequent, jobs?
Yes, of course, because actually, I just told that I haven't any idea when I go there before my leaving for there. But when I come back, I just have so many questions. Yeah. What's going on? And I'm so confused about the war or something. Okay. And then so when I look back to the process, I thought that it's a process to form my values. Okay. When I working as a volunteer. Okay. And so I realized that during the process, then I set my role or set my values that if I do this kind of work, my principle is that do no harm. Okay. Yeah, so it's quite, because I saw so many, their intention is good. Right. But sometimes it's quite difficult to do good thing. Okay. Yeah, so it's the process to form my values.
Yeah, but a lot of people will ask that, Min-Lun, what is the essential difference between a volunteer and subsequently an international humanitarian aid worker? What are some of the differences?
What's the difference? Is actually the work is similar.
Very similar.
Yeah, it's very similar. But if you are the worker, then there's no excuse that I don't know. Okay. Actually, because the circumference is uncertain. Okay. Yeah. And so many people are fear of making mistakes or something. But if you are the humanitarian aid worker, you can't. Yeah. You can't.
Because a lot of volunteers will ask you.
Yeah, so you need to accept everything and to try to make efforts to solve any problem for each one.
All right. Okay. And let's next talk a little bit about a country that you have been to for 45 years, and that is in Southeast Asia, and specifically Cambodia. Okay. All right. There's been, very little reporting about Cambodia today. Of course, we know that Cambodia went through a very traumatic experience in the last 20 years. Can you then tell us a little bit about Cambodia today?
Actually, I think it's rare to see some information or news from Cambodia or on TV program. Okay. But actually, the Cambodia is totally different from our image. Yeah. They have quite international phenomena and network in each industry.
Good. Right. All right.
Even, especially, of course, NGO industry, because so many. Because the country
really needs.
Really needs, and also the foreign aid accounts for 80% of the
80%.
Revenue of the country. Right. So that's why so many people and from everywhere, and they need to work together.
Exactly. Yeah. All right. You have been going there since, 2010? Okay. And so it's been almost 5 years. And what kind of research have you done while you were in Cambodia?
My first time to go to Cambodia is assigned to do some needs assessment because our organization would like to develop one long-term project there. Good. But so actually, the first time I stayed there for almost 3 or 4 months there. Okay. And then so we didn't have any idea what we can do, and because we need to base on our capacity. Okay. Right. And also, it's our first time to go there. It's not possible to do some intervention project there. Okay. So it's better to do some pilot and to work with local partner and to figure out what can we do in the field. Okay. So almost 5 years, but actually we spent almost 1 or 2 because it's totally different from previous project. This time we conduct the community-based project. Before we just work with the institutional, just like in church, like a school. Then we just church. Then we just contact because we have the key person to contact. But the community is totally different from the situation because some political issue or some social effects, so many, and we need to take it into consideration. So it's totally different. So it takes much time to stay in the village. Then I need to observe what's their daily life there and what are they doing, and when to see that when they got sick, what they will do, what's their decision-making process, and everything. Then I need to spend much time to stay with them. That's why we do the needs assessment for, I think, more than 1 year. But actually, at the time we did the pilot project to work with the local partner because they focus on education, especially for preschool, just like age under 5.
Very young children.
So just like kindergarten. So at that time we just, it's good. Then probably we could work together and then we just set the kindergarten preschool in the village. Because if they would like to get the preschool education, they need to, the small children, they need to probably walk for 30 minutes, but it's impossible and it's unsafe for them.
And we understand that you once said and believe still that health and education cannot be separated, that they go hand in hand. Can you elaborate on that, perception?
That's what I got lesson from the previous, the first 2 years, because I found that if you would like to, for example, if we would like to focus on nutrition issue, then it's possible. It's impossible to do the intervention for only one factor, because the poverty is just like a poverty cycle that it's related about education. If you draw the problem trees, then you could see, the tree is so strong that because it's related so many different dimension. So that's why, because we focus on the children malnutrition. So that's why we cooperate with because we set the preschool in the village, right? So at the same time, then it's actually health outcome is related to their health behavior. Right. Just like, for example, if they why they got diarrhea so often, then it's because their food or the water, or because they didn't wash their hands before meals. We need to cut all the pathway to the outcome. Right. So that's why we think that it's because it's actually education and health issue is combined together. If you do health issue, then it needs to get involved in education
as well. But Cambodia has been, of course, been the recipient of a lot of international humanitarian aid. But the society is still fairly closed within itself. How do you then, as a humanitarian aid worker, try to convince and try to persuade the parents to accept the nutrition program that you mentioned?
Yes, actually the first thing that, because of course I need to stay with them for a long time. You need to show up so often. You need to let them see
their trust.
To build the relationship in the community. It's quite important. It's a gate. And then when I get into the village, then I just think that because they didn't think that malnutrition is an important issue for them, because they see that their child is still alive. And they could walk everywhere. They didn't think that it's quite important.
All the kids
it's fine.
Acting the same.
Yes, right. So they didn't think that, why?
It was a big issue.
Yeah, it's a big issue. So at that time, I just think that I need to find a way that to let them feel that, it's kind of important. So because I need to go to the village to conduct so many village meetings, just with the meetings with the villagers. So I just invite them to come here and we have some discussion. I just ask them that because so many caregivers there and they are mothers. So I just ask them, did you have any got dizzy or something when you sit down and stand up? What's your feeling? Some of them that they cannot stand up immediately because I think most of them, according to the report or research also, they show that they got the anemia. It's kind of malnutrition.
Of course.
Yeah, so they feel, uncomfortable. So they got the feeling it's quite strong. They can understand what's the situation. I just told them, it's one kind of malnutrition. So it's quite important, and if it's quite important for the children because if you still ignore this issue, then probably later they will have different problems of their health.
So, different symptoms.
Yeah, so that's what my way to convince the parents to work with us, even we didn't provide any subsidy or some
incentives or things. All right. But Min-Lun, let me ask you, of all the places that you have been to, all the traveling that you have done, there must have been times when you were a little depressed. For example, maybe in Cambodia, that you were not able to persuade the parents. They were not comfortable with you. They don't know you well enough yet. And there were also, obviously times that you felt the work that you did was really making a difference in people's lives. How do you deal with the ups and downs in the last few years as an international humanitarian aid worker?
Actually, I think it happens often.
I can imagine.
Because it's uncertain. Everything's uncertain, and I didn't know what's the outcome or what it will lead. The direction I didn't know sometimes, but actually, sometimes I will cry or something. Sometimes I will how to do, and also because, but I must say that I'm so lucky because I found, because we work in the field, right? So we know some organization or some other humanitarian aid worker. Then I will consult them because actually I have one mentor in the field.
Good.
Yeah. So if I have anything or have some problems, I can understand, or I can reach, or I can everything. Then I will consult him, and he gave us much support. Good. Sometimes they're more than our headquarters.
All right. And also, let me ask you, in the last few years, you have been working for and with many of the international NGOs. And what is the experience like? Of course, some of these international NGOs are fairly big. They have a lot of human resources as well as supplies, resources. And then how is that experience in terms of making yourself a better international humanitarian aid worker?
Actually, I found because in the field, and I could find different organizations to work together. Then some of them are national level organizations, and some of the international level, just like UN or UNICEF or World Food Program. But for us, we are the grassroots organization. Actually, I just see that because some national level or international organization, they cannot reach or cannot understand what's the real needs in the village. Because when they deliver service in the field, then when it finished, then they disappear. So actually, it's quite difficult to reach the needs for the village. Village people. So, but grassroots organizations have limited resources to do more or expand their project. So, what's my role? I set for myself is that I need to be the bridge between this, because probably
that's wonderful. Yes,
because I can understand, or I can have this kind of ability to do some grassroots and to approach them, but also it's fine for me to stay in the field and in the village.
Terrific. Tell us a little bit about the impact that your project, your program, has subsequently produced in Cambodia? Please.
Actually, the question is quite difficult to answer this because for the Taiwan project, it's quite difficult to measure the outcome because probably after 5 years or 10 years, then you could see the result probably. But till now, I found that also according to our report something, then we found that the people to have more awareness about their child's health. Just like till now they think they treat us as a positive way. It's quite impressed that we didn't provide any subsidies or supplement to them to ask them to measure their height, weight, and circumference every month to come here because we need to identify who is at high risk, and we need to have different strategy for them, high risk and middle and low. So it's quite. I think that if they know it, then I think that it will reduce the possibility to get malnutrition. Right.
All right. But what are some of the challenges that you see that still remain? You know, for example, now that people start to pay more attention about their health, and what are some of the things that they still need to overcome?
Yeah, actually, we are make our efforts to figure out what's the possibility to solve the problem of malnutrition. And till now, we found that there are lack of protein, to take protein. And for them, because it's quite important factor to grow up for the children. And then so we try to find the local resources to solve this. Just like, so we found the soybean milk. So probably it's kind of a resource because it's easy and convenient and not expensive like meat. So later on, we would like to, it's our responsibility that to find a way to continue to do this work, and also because we need to find the sustainability, and so we would like to cooperate with the village women together. Then probably we could assist them to build the cooperatives, just like they are the owner of themselves. Then they could provide the nutrient food to the children in the village.
Min-Lun, then since you said that health and education should go together, and now people start in Cambodia start to pay more attention on health issues, are they also paying more attention on the importance of education? Are they letting their children, young children, to start receiving education at the age that they're supposed to?
Actually, I will focus on health education. Because I'm not expert on education.
You're too modest. Yes.
So for my idea is that we don't want to just like to let them have lectures and to learn something, but we will demonstrate them or to ask them to invite them to join our campaign or activities. They could learning by doing. Then just like we have some cooking class, then we work from how to clean the container. We need to demonstrate what's it cleans like this. And also to prepare safe food for them, and then how to prepare safe food for the children. What kind of food is suited for the children? So we need to work with them together, and because most of them they didn't study in school or some not longer.
And Min-Lun, you have also worked with Taiwan's NGOs. How is your experience with Taiwan's NGO compared with the experiences that you had in South India, Malawi, and also Cambodia? I mean, of course, the project may be different.
Yes.
But
I got 2 lessons from international NGO actually. The first thing that professionalism. Actually, the perception of NGO worker in Taiwan that almost, I think, 90% of people will think that they are volunteers, right? But not only passion could work. You need to equip some skill or capacity. something like this.
Good.
And the second thing that, because mostly, I think till now probably, how they make their decision.
Okay.
And it's better for probably I guess sometimes they will make decision by they would have evidence base and to make why they make this decision. What's the report or what's going on now? But before then, actually the decision making process should be like this way, but not I thought or the boss said. Actually, sometimes because it's a kind of NGO work, not business, right?
Oriented.
So we need to think about more. What's the evidence show us, and we need to follow this, but not the boss like it or not, because it's the NGO. We need to do the right thing.
All right. Min-Lun, a question that some people who are watching our program today may want to ask you is, in your opinion, what are some of the necessary qualities for international humanitarian aid worker? What would you recommend?
For the youth, I think that the first thing that you need to equip yourself, and no matter its capacity to the language.
Okay.
And also, I would like to focus on professional field. And no matter you are the finance or accounting or ICT or medical doctor or public health specialist.
Okay.
It's quite important because I found that some experts from other countries actually they show their attitude and show their ability, and I think we need to do by this way.
All right. And would you think maybe for international humanitarian aid worker that he or she needs to have some particular skills? For example, if I'm good in computers, maybe I can go to some of these places in Africa or in Southeast Asia to teach the children or even adults how to work a computer. Or if I have some experiences and knowledge in the field of public health, like yourself, that I can educate them on the importance of health protection. So do you think that a set of specialized skills will also be helpful?
Okay. Actually, it depends on your work or demand.
The program.
Just like NGOs all need the financial or accounting. Actually, NGO not only for us just to work in the field, but the headquarters is quite important because if you are the ICT or engineer, probably you need to know what's the engineer apply in the field, how to run. But actually, I think most important is the attitude or what's your attitude to work in the field.
All right.
Yeah, be curious and to respect and to listen. Don't afraid of making mistakes because you can get lessons from that. But you need to have a correct attitude toward this.
All right, Min-Lun, the final question I'm going to ask you is, Min-Lun, now you have been out of university for some time now. Certainly, you have had very rich experiences, traveling and working in many different parts of the world. But if people like myself will come up to you and ask you, Min-Lun, do you ever have second thoughts about making this your career choice? Because nowadays, when you come back to Taiwan, you probably meet your friends from college or graduate school. They may be working very, steady jobs or, in large organizations or maybe for government. So do you ever, wonder to yourself that, hey, if I didn't choose this particular path, I could be doing the same thing or even, things very similar, even better. Than what they're doing.
Yeah.
Do you ever have those moments of conflict?
Okay. Actually, now I just take a break of my life. Then, I stay during this period. I stay in Taiwan.
Good.
And I I'm trying to seeking for my position in Taiwan and what can I do for our society.
Good.
Yeah, I still probably I need to do something. I know that I need to do something or to have some feedback.
Okay.
To our society.
Are you going back to Cambodia soon?
Probably.
Okay. Later this year?
Yes.
Good.
Yes.
We certainly enjoy very much having you on the program today, Min-Lun. I certainly learned a lot from your experiences around the world. I want to wish you all the best in your future professional and personal endeavors. Thank you very much.
Thank you very much.
All right. And thank you for watching our program today. I'll see you next time on MacroView Television. Thank you.